A DVT, or a deep vein thrombosis, is a blood clot that develops in the deep veins of the body. So our arms and legs have two sets of veins, deep veins and then superficial veins, or extra veins, if you will. Like in the arm, they're the veins we put IVs in. There are many risk factors for a DVT, such as immobility, like if you're in a long car ride or a long plane ride, or recent surgery that either was a big surgery or just causes you to be immobile for a prolonged period of time. And then there's reasons for what we call an unprovoked DVT, which means you don't have a reason, such as a long car ride, and that can be caused by some genetic abnormality or hormone replacement therapy, such as birth control pills, having cancer, obesity, really bad lung disease. Those are all risk factors for developing a DVT. If someone develops a DVT, they will often present with either pain or swelling or both in an arm or a leg. Most commonly they develop in the leg, so it would be in one leg or the other. The best test to check for a DVT is an ultrasound, which is a non-invasive test. So all it involves is an ultrasound probe that's put onto the skin over some gel, and they look at your veins to look and see if there's a blood clot within them. So it's typically pretty painless, and it's similar to an ultrasound when you're pregnant and looking at the baby. The main treatment for a DVT is anticoagulation or blood thinners. It's typically in the form of a pill taken every day, and it's usually given for 3 to 6 months. There are certain circumstances, depending on where the DVT is or where the blood clot is, that may lead your provider to suggest a procedure that can help break up some of the clot, but the majority of blood clots are just treated with blood thinners, which are pills. One concern with a DVT, if it's left untreated, is that it can develop into what's called a pulmonary embolism. So a piece of the blood clot can actually break off and go into the lung, which can be quite dangerous. So if someone has a DVT and then develops any chest pain or shortness of breath, it's typical that they are urged to go immediately to the emergency room to be evaluated for that. Other complications can be long-term swelling or pain in the leg if the blood clot does not fully resolve. That's usually treated with compression stockings. At Vascular Institute of the Rockies, we have everything that we need to diagnose and treat you for a blood clot. So if there's any concern that your doctor has, they can send you to us and we can do an ultrasound and see you the same day. And it's something that we deal with every day, so we're kind of the experts on the topic, and we will get you feeling better and back to your normal life as soon as possible.